Hi, I'd like to welcome you to my classroom. My name is Susanna Nelson from Mind-Unwind, and I just thought I'd take a few moments just to introduce you to some of the balls that we're going to be using in class. The yoga chin-up and role model therapy balls to help us do some self-massage, some self-myofascial mobilization to help rehydrate some of the sort of stuck, glued down muscles, connective tissue that we get. Sometimes we'll be using the balls to calm down our sort of a nervous system. Sometimes we'll be waking things up a little bit, and other times we'll be calming and soothing our soft tissues. So one of the balls that we use in class is a soft, grippy, air-filled ball that you can blow up with a straw, called a cordless ball. So this ball is sort of mimics skin, and it's got a massive amount of shear and grip. So when you put it onto some tissue, it actually twists and wrings out that tissue. So if I put this on my leg and twist it around, then you can see that that actually grabs and actually tweaks some of the skin, gets into some of those deeper muscular layers. We're not quite sure whether you can see that that is actually wringing, twisting out my skin, connective tissue. So you get, can you see, even though I'm actually on the side of my elbow, that skin is sort of transitioning around my elbow. You can see it's actually moving slightly away. So it's grabbing, twisting, wringing out. And we use this for a lot of global shear and skin rolling. So this also is really good for belly, ball, pelvic work, visceral abdominal work. And it's a really good tool to actually help us connect to our diaphragm and actually help the diaphragm move down, because we release a lot of the tension in our underneath our rib cage into the diaphragm. The diaphragm actually sits up under here. So if we had a sort of a smallish ball, the diaphragm actually sort of sits up a bit like a dome. And so when we breathe in, it draws down and it pushes our abdominal organs out. So for instance, so if I'm breathing using my diaphragm, as I breathe in, my diaphragm moves down. As I breathe out, it goes up. Breathe in. Diaphragm moves down, pushes all of the abdominal contents out. Breathe out. If, on the other hand, I'm breathing in my upper clavicular area, then what this looks like is, or people actually feel that they're breathing in and they take a big breath in, and everything's all up here. And what happens is that as you breathe in up here, this diaphragm gets glued up here, and it can't move down to help you suck more air into the lower part of your lungs. So ideally, we want to be able to breathe down into this area. So using things like the cordless ball enables us to actually connect to loosening up some of this, all of our connective tissue, creates a little bit of space, unglues us from this slightly rounded, flexed position. So if we've been in this forward position a lot of the times, whether it's driving, texting, computing, habitual posture is falling forward. So we'll use the balls to wring out some of this tissue. We'll do stuff where we're lying on the floor, lots of skin grip and grab, just to try and release, soften, move. Cordless ball we use in class, and a small set of balls which mimics the pressure of a therapist, a soft tissue therapist's thumb. So when I'm doing my body work, this is about the equivalent of thumb pressure. So they come in a set, so toted in a ball, and so actually the grip of the tote, actually the ball comes through the tote, so it also grips into your skin. So it can be used as a tote, or like a mini foam roller, or usable singularly. So these are the small yoga chin-up therapy balls. Pressure of the thumb. Absolutely brilliant for things like the feet. So we would take one out and use one to do some footwork. So in class we regularly do footwork, so we're using the balls just to try and wake up our connective tissue. That's the plantar fascia. So you can roll, you can strip across the muscles, you can go with the grain. So going with the grain means you're going down the grain of the muscles, whereas if you're cross-fibering something, so now I'm going with the grain of the plantar fascia, obviously on my foot, but I'm just sort of showing you the direction on my leg. Cross-fibering means that we're going across the grain of the muscles, the tendons, the direction of pull. So using those for a lot of footwork. We also use the small balls. They're brilliant for things like getting into sort of elbow joints, really good when you want to do some handwork, and also we use them in the back of the occiput. So if you're using the balls, oh dear, arm's just fallen off. Using the balls on the back of the occipital ridge. So often if we're in this position, everything's working really hard at trying to keep your head on your neck. So we do some lovely things in class that involve helping ourselves de-stress. Placing the balls back of the occipital ridge, which we often do if we need to de-stress, stretch and lengthen the neck and allow ourselves to come into more of a parasympathetic resting state. So with these muscles we can be stripping up and down. We can also be doing a little bit of cross-fibering. You can also do a little bit of cross-fibering stripping, some sustained compression, where the head is just allowing our head weight just to meet the balls. Slow, relaxed breathing. So this can be done of its own, just on its own as a nice down regulating sequence. It can obviously be used as part of a more dynamic neck-shoulder sequence. So they fit brilliantly. So you've got a yoga brick, a small set of balls, and the gorgeous ball. That's the minimum that we use in class, and a yoga brick that's about that size. So whether you get them from me or whether you get them from online, that's up to you. If you decide that you actually want to have a full set of screwdrivers, as it were, then we use an alpha ball. So if you're working one-to-one with me, the chances are you will be using a full kit. If you're coming to the class, then that will be included. The ball will be included. It's up to you about the brick. Medium-sized balls mimic elbow pressure. So again, if you've been to a soft tissue therapist and they've used their elbow on you, then it will feel less pokey, poking you with something that size, than it will with a finger. And then the biggest pressure is like a fist, which is the alpha ball. So we use the alpha ball in big muscle groups. So for instance, you can be working into your glutes, so you may be going with the grain, where you'd be rolling sideways. You can be rolling up and down, which means that you're crossing the grain. Obviously, it's not quite anatomically correct. So you can use the balls, again, where you'd be stripping down the side and rolling side to side. And often we need to be able to actually cross fibre to be able to pull these fibres apart to actually get more space, so that things can actually feel less restricted, less constricted. So medium balls, and again, it depends on your body size. So if you are a bigger build and you've got more muscles, then you may find that you need a bigger tool. The alpha balls does come in a pair as well, so you can actually put those into a tote. I've only got one to hand, and that becomes like a really big foam roller. So if you like less discomfort and you like to be able to roll, then you can get an alpha ball tote. So, very much looking forward to welcoming you to my online space. We have my little friend here that helps with some of the bony landmarks. So for instance, I may well be showing you where to place the balls in class. We do a whole load of stuff on the floor, we do a load of stuff on the wall, and then he just helps with a little bit of the visual so that you know where you're rolling. Thanks very much indeed, and I will look forward to seeing you soon. Thank you.